Hello, and a warm welcome to ElderCare Insights. Let me start by asking a question, and I want you to know that you are in a safe, private space here. Have you noticed changes in your sexual health as you've gotten older? Perhaps things aren't working the way they used to, and it's causing you some private worry, some frustration, or even some distance between you and your partner. If that sounds familiar, I want you to take a deep breath and know two things. First, you are far from alone. Erectile dysfunction, or ED, is one of the most common health concerns for men over 60. And second, there is real, science-backed hope, and there are effective, safe solutions. Today, we're going to put aside the myths and the sensational online claims. Instead, we're going to have an honest, in-depth conversation about what erectile dysfunction really is, what your body might be trying to tell you, and the proven strategies you can use to manage it and reclaim your confidence and intimacy. This is about your total health and well-being. We are ElderCare Insights, and our mission is simple: to provide you with reliable, evidence-based information to help you live a healthier, more fulfilling life. And before we go any further, our mandatory disclaimer. The information in this video is for educational purposes only and is not a substitute for professional medical advice. Always consult your doctor or a qualified healthcare provider with any questions you may have regarding a medical condition. Now, let's get started. I encourage you to watch until the end because we're going to build a complete roadmap for you. If you find this conversation helpful, please take a moment to click the like button below. It truly helps our channel reach others who need this information. Section 1. The Foundation. Understanding the physical causes of ED. To truly solve a problem, we first have to understand it. Many men believe that ED is just an inevitable part of getting older, but that's not the full story. More often than not, ED is a signal, a messenger from your body about your overall health. Let's break down the main physical reasons it can happen. Point number 1. It all starts with blood flow, your vascular health. The most fundamental part of an erection is simple: healthy blood flow. An erection happens when your brain sends signals that relax the arteries in the penis, allowing blood to rush in and fill the tissues, making it firm. The most common physical cause of erectile dysfunction is compromised vascular health. Think of it like the plumbing in your house. If the pipes are narrowed or clogged, you won't get good water pressure. It's the same with your body. Conditions like high blood pressure, high cholesterol, and diabetes can damage and narrow your arteries over time. This damage, called atherosclerosis, restricts the powerful blood flow needed to achieve and, just as importantly, maintain a firm erection. This is critically important. The connection between your heart health and your erectile health is incredibly strong. In fact, think of ED as a potential canary in the coal mine for your heart. The arteries in the penis are much smaller than the arteries around your heart. This means they are often the first to show signs of blockage or damage. For many men, the onset of ED can be an early warning sign of underlying cardiovascular disease, sometimes appearing 3 to 5 years before other heart-related symptoms show up. So when your body is having trouble in this department, it's not just a bedroom issue. It's a sign that your entire circulatory system needs attention. What this means for you is that the very same things your doctor recommends for your heart are the very same things best for your erectile health. When you work to lower your blood pressure, manage your cholesterol, and keep your blood sugar in check, you are directly helping to protect and restore the blood flow necessary for healthy erections. This isn't about a quick fix. It's about investing in your long-term, whole-body health and your sexual vitality is a direct beneficiary of that investment. Point number 2, the role of hormones. It's not just testosterone. We hear a lot about low T on television and online, and hormones do play a significant role in a man's vitality, energy levels, and sex drive. As men age, there is a natural gradual decline in testosterone, typically about 1 to 2% per year after age 30. This can certainly affect your libido or sex drive and contribute to lower energy levels. You might feel less interested in sex than you're used to, or your body's response might feel less intense. While low testosterone can be a contributing factor to ED, it is very rarely the only cause. Many men with normal testosterone levels experience ED due to vascular or psychological reasons. Furthermore, your body's hormone system is complex. Other hormonal issues can also play a part, such as problems with your thyroid or elevated levels of a hormone called prolactin. This is why simply buying an over-the-counter testosterone booster is often ineffective and can even be risky. It's like trying to fix a car engine without knowing which part is broken. The key here is to work with your doctor. If you're experiencing symptoms like low libido, fatigue, and ED, ask for a comprehensive blood panel. This test can check your testosterone levels accurately, but also screen for other hormonal imbalances that could be at play. This gives your doctor the full picture, allowing for a precise diagnosis and a treatment plan that addresses the actual root cause, rather than just guessing. Point number 3, the nerves and muscles that make it work. Getting an erection is more than just blood flow and hormones. It's a complex event that requires precise coordination between your brain, your nerves, and specific muscles in your pelvic region. For an erection to be firm and last, blood has to be effectively trapped inside the penis. This job is done by a group of muscles at the base of your penis known as the pelvic floor muscles. Just like any other muscle in your body, these muscles can weaken over time due to age or lack of use. Additionally, the nerve signals themselves can be disrupted. Conditions that cause nerve damage like diabetes or complications from prostate surgery can interfere with the communication pathway from your brain to the penis, making it difficult for the process to even start. This explains why some men might be able to achieve a partial erection but struggle to maintain it. The blood flows in, but weak pelvic floor muscles can't keep it there effectively. It also explains why men with certain neurological conditions face a higher risk of ED. It's a reminder that erectile function is a sophisticated, coordinated process. The fantastic news here is that you can strengthen these muscles just like you can strengthen your biceps. Specific exercises, often called Kegel exercises for men, directly target the pelvic floor. Studies have shown that pelvic floor muscle training can significantly help men with ED regain function. We'll talk more about how to do these exercises later in the video. The first step is simply knowing that these muscles exist and that you have the power to make them stronger. Section 2. The powerful mind-body connection. Now that we've covered the physical hardware, we need to talk about the equally important software, your mind, your thoughts, and your emotions. For many, many men, this is the biggest piece of the puzzle. Point number 4. Breaking the vicious cycle of performance anxiety. Let's talk about the elephant in the room, anxiety. You have one experience where things don't go as planned. The next time, you find yourself worrying, what if it happens again? That worry itself creates stress and anxiety, and that stress is the enemy of arousal. This is what experts call performance anxiety, and it creates a powerful, self-perpetuating cycle. The fear of sexual failure leads to stress, And that stress makes achieving an erection physically more difficult, which then reinforces the fear for the next time. It can feel like an impossible trap. Here's the science behind it. When you feel anxious or stressed, your body goes into fight or flight mode. It releases stress hormones like adrenaline and cortisol. These hormones are designed for survival. They tighten your blood vessels and direct blood to your large muscles so you can run from a threat. This is the exact opposite of the relaxed state your body needs to be in for arousal, where blood vessels need to open up and relax. This anxiety doesn't just impact you for a moment. It can deeply affect your self-confidence, your mood, and your feelings about your own masculinity. Breaking this cycle is one of the most empowering things you can do. The solution isn't to try harder. It's to change your mindset. 1. Shift the goal. The goal of intimacy is not performance. It's connection, pleasure, and closeness. Take penetration off the table for a while. Focus on other forms of touch and intimacy to rebuild confidence without pressure. 2. Practice mindfulness. Mindfulness and deep breathing exercises are incredibly powerful tools. They train your brain to stay in the present moment rather than racing ahead with what-if worries. Taking just 5 deep, slow breaths before being intimate can switch your nervous system from stress mode to relaxation mode. 3. Cognitive behavioral therapy, or CBT. For persistent anxiety, working with a therapist on CBT techniques can be life-changing. It helps you identify those negative thought patterns and actively challenge and change them. Point number 5. The weight of daily stress and depression. It's impossible to separate your sexual health from your overall mental health. The stresses of daily life, worries about finances, your job, family issues, or other health problems, all take a toll. Chronic stress constantly floods your body with cortisol, which can suppress testosterone and interfere with sexual function. Beyond stress, depression is a major factor. Depression isn't just sadness, it's a clinical condition that alters your brain chemistry and can drain your interest in all the activities you once enjoyed, including sex. The link is undeniable, and it's a two-way street. Research shows that men with ED have significantly higher rates of both anxiety and depression. But it works in both directions. Addressing the ED can often improve your mood and confidence, and treating underlying depression or anxiety can dramatically improve your sexual function. Ignoring your mental health while trying to fix ED is like trying to patch a leaky roof while a hurricane is raging outside. You have to address the underlying storm. 1. Acknowledge it. Be honest with yourself and your doctor. If you're feeling persistently down, hopeless, or have lost interest in things you once enjoyed, talk about it. It's a sign of strength, not weakness. 2. Build a stress management toolkit. You need healthy outlets. This includes regular exercise, ensuring you get enough sleep, and practicing relaxation techniques like we just discussed. 3. Stay connected. Don't isolate yourself. Maintaining social connections with friends and family is a powerful antidote to stress and depression. 4. Seek professional help. Therapy and, if appropriate, medication for depression and anxiety can be incredibly effective and are a core part of a comprehensive ED treatment plan for many men. Section 3. Strengthening your partnership through ED. Erectile dysfunction doesn't happen to one person. It happens to a couple. It can create a silent space of misunderstanding and hurt, but it can also be an opportunity to build a deeper, more honest connection. Point number 6. The most important tool you have is communication. For so many men, this is the hardest part. There's a deep-seated feeling of embarrassment or shame that makes it incredibly difficult to talk about ED. But silence is the enemy here. It allows for assumptions and misunderstandings to grow. When you don't talk about it, your partner is left to guess what's happening. They might worry that you're no longer attracted to them, that they've done something wrong, or that you're angry with them. This can lead to them feeling rejected, which can cause them to pull away, creating even more distance and making intimacy feel even more stressful. Open, honest communication breaks this cycle of misunderstanding. It reframes the issue from a personal failure into what it truly is, a shared medical challenge that you can face together. Research consistently and clearly shows that couples who work together as a team have the very best treatment outcomes. Your partner often wants to be supportive but may not know how. Opening the door to conversation is the greatest gift you can give your relationship during this time. How do you start this difficult conversation? 1. Pick the right time and place. Do not try to talk about it in the bedroom, right before or after an intimate moment. Choose a neutral, relaxed time, over coffee in the morning or while taking a walk. 2. Use I and we statements. Start by talking about your feelings. For example, I've been feeling worried and frustrated lately because my body isn't cooperating the way I want it to. I want to talk about it so we can figure this out together. This is much better than a statement that can sound like an accusation. 3. Reassure and educate. Emphasize that this is a medical issue, not a reflection of your love or attraction. You can even say, I learned that this is often related to blood flow and other health factors, and it has nothing to do with how I feel about you. 4. Invite them to be your partner. Ask them to be part of the solution. This could mean helping you research lifestyle changes, or even offering to come with you to a doctor's appointment. This conversation can transform ED from a source of division into a catalyst for deeper intimacy and trust. Section 4. Your proactive lifestyle plan for better function. All right, we've covered the why. Now let's dive deep into the how. These are the practical, powerful steps you can take starting today to improve your health and, in turn, your erectile function. These are not quick fixes. They are long-term investments in your vitality. Point number 7. Movement is medicine, the unmatched power of exercise. If there is one single non-medical intervention you can make for your erectile health, it is regular physical activity. It is one of the most effective strategies available. A sedentary lifestyle is a direct contributor to the poor vascular health that underpins most cases of ED. When you don't move your body, your circulatory system becomes less efficient, your blood vessels can become stiffer, and your heart has to work harder. Exercise works on multiple fronts. First and foremost, aerobic exercise directly improves your cardiovascular health. It makes your heart stronger, helps keep your arteries flexible and clear, and boosts circulation throughout your entire body, including to the penis. The recommendation from studies is to aim for at least 160 minutes of moderate intensity aerobic exercise per week. That's about 30 minutes 5 days a week. Men who engage in regular aerobic exercise show significant improvements in erectile function compared to those who are sedentary. What does moderate intensity mean? It means you're moving enough to raise your heart rate and break a sweat, but you could still carry on a conversation. Brisk walking is fantastic. You don't need a gym, just a good pair of shoes. Cycling, swimming, or even using an elliptical machine are all excellent choices. Swimming and water aerobics are particularly good as the water supports your joints and the pressure can enhance circulation. Let's return to those pelvic floor muscles. To find them, the next time you are urinating, try to stop the flow midstream. The muscles you use to do that are your pelvic floor muscles. Do not make a habit of doing this while urinating, but use it to identify the muscles. To perform the exercise, simply sit or lie down comfortably and tighten those muscles. Hold the contraction for 3 to 5 seconds, then relax for 3 to 5 seconds. Aim for a set of 10 repetitions 2 to 3 times a day. Be patient. It takes a few weeks to build strength, but studies show this is a highly effective technique. Point number 8. Fueling your body for success. The erection-friendly diet. You've heard the saying, you are what you eat. When it comes to erectile function, this is absolutely true. The food you eat has a direct impact on your cardiovascular health, your hormone levels, and your energy. Simply put, a diet that's good for your heart is a diet that's good for your erections. A diet high in processed foods, sugar, unhealthy fats, and salt contributes directly to the problems we discussed earlier: high blood pressure, high cholesterol, inflammation, and weight gain, all of which are major risk factors for ED. Healthy eating works in 2 key ways. First, it helps to reduce the damage to your blood vessels. Second, certain foods can actively help improve blood flow. The key player here is a molecule called nitric oxide. It's a natural chemical your body produces that helps relax and open up your blood vessels. Many ED medications work by enhancing the effects of nitric oxide, but you can also boost it naturally through your diet. Boost nitric oxide. Eat more foods rich in natural nitrates, which your body converts to nitric oxide. The superstars here are leafy greens like spinach, arugula, and kale. Beets and beet juice are also famously potent. Other great choices include watermelon and pomegranates. Fight inflammation with the Mediterranean diet. This isn't a restrictive diet, but a pattern of eating that is consistently shown to improve erectile function. It's rich in fruits, vegetables, whole grains, and healthy fats. Think olive oil instead of butter, fish like salmon instead of red meat, and plenty of nuts, seeds, and beans. This eating style helps to reduce the chronic inflammation that can damage your blood vessels. Manage your weight. Maintaining a healthy weight is crucial. Obesity significantly increases your risk for ED because it negatively impacts testosterone levels, increases inflammation, and worsens cardiovascular health. Even a modest weight loss can lead to significant improvements. Point number 9. The forgotten pillar of health: quality sleep. We live in a culture that often treats sleep as a luxury. It is not. Quality, restorative sleep is absolutely essential for your physical, mental, and sexual health. When you consistently get poor sleep, you are throwing your body's entire system out of balance. You wake up feeling tired, stressed, and your body is in a state of constant low-grade emergency. Sleep is when your body does its most important repair work. Critically for sexual health, the majority of testosterone production happens while you are sleeping. Poor sleep disrupts this process. At the same time, lack of sleep increases the levels of stress hormones like cortisol, which, as we've learned, are terrible for erectile function. Prioritize it. Aim for 7 to 9 hours of quality sleep per night. This is non-negotiable for good health. Create a sleep sanctuary. Make your bedroom a haven for rest. Keep it cool, dark, and quiet. Establish a wind-down routine. An hour before bed, turn off the screens, the TV, the computer, the phone. The blue light disrupts your body's production of melatonin, the sleep hormone. Instead, read a book, listen to calm music, or do some light stretching. Try to go to bed and wake up around the same time every day, even on weekends. This helps to regulate your body's internal clock. Section 5. Navigating medical treatments with your doctor. Lifestyle changes are the foundation, but sometimes they are not enough on their own, and that is perfectly okay. Modern medicine offers some highly effective and safe treatments. The key is to approach these as a team with your doctor, who can help you find the right option for your specific health profile. Point number 10. First-line medical support. PDE5 inhibitors. You have probably heard of these medications by their brand names, like Viagra, Cialis, or Levitra. The medical name for this class of drugs is phosphodiesterase type 5, or PDE5 inhibitors. They are the most common and effective first-line medical treatment for ED. These medications are designed to directly address the primary physical problem in most ED cases, insufficient blood flow. Let's demystify how they work. These pills do not magically create an erection out of thin air. They work by enhancing your body's own natural process. They amplify the effects of nitric oxide, the chemical we talked about earlier, which relaxes the blood vessels in the penis. This makes it much easier for blood to flow in when you are sexually stimulated. This last part is crucial. They do not work without sexual arousal. This is a conversation to have with your doctor to see if you're a candidate. If you are prescribed one, here are the key things to know. Timing is everything. Some, like sildenafil, Viagra, are taken 30 to 60 minutes before you plan to be intimate. Others, like tadalafil, Cialis, can work for a much longer period, up to 36 hours, offering more spontaneity. Take on an empty stomach. Many of these drugs work best when not taken with a heavy, fatty meal, which can slow down their absorption. Be aware of side effects. Common side effects can include a headache, facial flushing, or a stuffy nose. These are usually mild and temporary. The most important warning: you absolutely cannot take PDE5 inhibitors if you take a class of heart medication called nitrates, often used for chest pain, such as nitroglycerin. The combination can cause a sudden, dangerous drop in your blood pressure. Your doctor and pharmacist will stress this point, and it is non-negotiable. Point number 11. When hormones are a factor. Testosterone replacement therapy, or TRT. If your comprehensive blood tests show that you have clinically low testosterone and you have the symptoms that go along with it, your doctor might discuss testosterone replacement therapy, or TRT. For men with a confirmed deficiency, TRT aims to restore hormone levels back to a normal range. When used appropriately, TRT can improve energy levels, mood, muscle mass, and sex drive. However, it is crucial to understand that TRT is not a fountain of youth or a cure-all for aging. It is a specific medical treatment for a specific condition, diagnosed testosterone deficiency, also known as hypogonadism. It is generally not an effective primary treatment for ED in men with normal testosterone levels. TRT is not something to be taken lightly. It requires careful monitoring by your doctor due to potential risks and side effects, which can include things like blood clots or affecting your prostate health. This is a serious medical decision that must be guided by a qualified healthcare provider based on thorough testing and regular follow-up. Point number 12. Advanced options when first-line treatments aren't enough. For some men, oral medications may not be effective or appropriate. If you're in this situation, please do not lose hope. The field of urology has several other highly effective advanced treatments. These are typically managed by a specialist, a urologist. These options are for men with more severe ED or for those who cannot use or do not respond to PDE5 inhibitors. It means there's a solution for nearly every man. The goal is to restore function and confidence, and there are multiple paths to get there. Here's a brief, respectful overview of what these options are, so you're aware of them when talking to a specialist. Low-intensity shockwave therapy, or LSWT. This is a newer, non-invasive treatment that uses low-energy acoustic waves to stimulate the growth of new blood vessels in the penis, which can improve natural erectile function over time. Penile injections. This may sound intimidating, but for many men it is a highly effective and reliable solution. Using a tiny needle, a man injects a medication directly into the base of the penis that relaxes the arteries and produces a strong erection. Many men report it is nearly painless and find the results to be excellent. Vacuum erection devices, or VEDs. This is a mechanical, non-drug option. A plastic cylinder is placed over the penis, and a pump, either manual or battery-powered, creates a vacuum that draws blood into the penis. A soft constriction ring is then slipped onto the base of the penis to maintain the erection. Penile implants. This is a surgical solution, typically considered when all other treatments have failed. It is a permanent and highly effective option that provides a man with the ability to have an erection whenever he chooses. Modern implants are sophisticated and provide a very natural feeling and high rates of satisfaction for both partners. The key takeaway here is that there are many rungs on the ladder of treatment. Don't ever feel like you've run out of options. Conclusion. We have covered a tremendous amount of ground today. We've talked about blood flow, hormones, the power of your mind, the importance of your partner, and the wide range of lifestyle changes and medical treatments that are available. The single most important message I want you to take away is this: erectile dysfunction is a treatable medical condition, not a personal failing or something to be endured in silence. It is almost never caused by a single thing, but rather a complex interplay of your physical, mental, and relational health. And because of that, a comprehensive approach, one that addresses your diet, your stress, your relationships, and works with your doctor, is what brings the best, most lasting results. Taking that first step to learn more, to talk to your partner, to make an appointment with your doctor, is a true sign of strength and self-care. I want to thank you for trusting us with your time today. In the comments below, we invite you to share, discreetly of course, perhaps one lifestyle change you're considering making. Sharing our journeys can help us all feel less alone. If you found this guide valuable, please subscribe to ElderCare Insights and turn on notifications. We are committed to bringing you more reliable, in-depth guidance to help you understand, plan, and thrive in your later years. Thank you for watching. Be well, and we'll see you next time.